Hi learners, it's Em from Sononerds, and this video is on Unit 17b, Contrast Harmonics. As I had mentioned in Unit 17a, I did split this into Units 17a and 17b because tissue harmonics and contrast harmonics do have some similar physics conversations, but they're different enough in which I felt like it would be appropriate to split them up. So we are going to continue our harmonics discussion, focusing on contrast harmonics. Section 17b.1, Contrast Agents. Contrast agents are also known as microbubbles, and they are these tiny little gas bubbles that are used to highlight anatomy and pathology within the body, as they have a completely different appearance than blood or tissue. Contrast agents are usually going to be injected through an IV, or they can also be digested. Currently, contrast agents are used widely in the cardiac ultrasound applications. General ultrasound is starting to use them a little bit more, but very few contrast agents are approved for tissue use in the United States. Common types of contrast agents used in the United States, as approved by the Food and Drug Administration for echocardiography, are going to include Definity, Optison, Imagent, and Lumason. They all come in vials like this for easier injection into the IV. Definity is probably the most common one that is used in most clinical settings. You notice that it says activate prior to use. You actually need to activate Definity to make the little tiny microbubbles so they can be injected and used for the echo. When we use contrast agents, we see that they can help the sonographer in three major ways. Firstly, they're going to help us to identify lesions when their echogenicity is similar to surrounding tissue. We also see that they are going to help to characterize lesions through documentation of arterial and venous phases. And then lastly, we'll see that they add Doppler detection in weak flow areas. So basically what we're seeing here is that the contrast agent is injected into the body through the IV. We're going to watch as the heart moves it around. We can look in the heart itself, see the contrast agent in there. It'll help us to identify filling defects within the ventricles. It can help to identify how the walls are moving. It has a lot of fantastic uses in the cardiac realm. After the contrast agent has moved through the heart, if we are using it for soft tissue like the liver or for the kidneys, the contrast agent will travel into the organ in an arterial phase. It'll sweep into the lesion during the arterial phase. The way it does that can help to identify borders of the lesion. It also helps to identify, does it have malignancy markers, or it might not flow into it at all, which actually also helps our documentation. And then we'll be able to see as the contrast agent leaves the lesion, we'll see how the lesion reacts during the venous phase, which also helps to characterize lesion. And lastly, because the contrast agent is moving anywhere that blood can move, we can actually get a better Doppler signal from the microbubbles that are moving through the blood vessels to get even more information about the velocity and type of blood flow through that area. There are a few contrast characteristics that we need to be aware of. Ultimately, contrast agents have to satisfy 5 rules to be used as a contrast agent. First and foremost, they have to be safe. We can't be injecting these into people and then having tons of people have allergic reactions or causing some sort of adverse event later. So we need safe injectable contrast agents. Next, they need to be metabolically inert. Again, we don't want to be injecting things into people that are going to change things in their body. So we really just want it to be as simple as saline. It goes in, it dissolves, and nothing is left behind from it. Third, we want it to be long-lasting. If we inject it into a vein, it's got to get back to the heart so we can see it. If it dissipates before it even gets back to the heart, then there's no point in using it. So we want to make sure that it's long-lasting to get it into the heart so we can see it and use it for our images. Fourth, we need it to be a strong reflector of ultrasound. Again, if it doesn't reflect ultrasound in the way that we need it to, it's pretty useless to us. So we want to make sure that it resonates or interacts with our sound beam in a way that creates good, strong reflections. And lastly, it has to be small enough so it can pass through capillaries. We want the contrast agent bubbles to be small enough that they can go anywhere that blood can go, because that is going to help us to characterize lesions, to characterize blood flow, to improve our diagnostic quality. Some other things that we're looking at for the contrast characteristics are what is the outer shell made of and what is the gas that is used to make the microbubble. So on top of those rules, we have these two characteristics that are important. So the shell, which is responsible for trapping the gas and determines the contrast agent stability and longevity in the blood. If it didn't have a shell, that means that the bubbles would shrink and dissolve very quickly. And we can see that with agitated saline. Saline is basically just salt water. We can shake it up, make a lot of bubbles in it, but the second that those bubbles or the agitation is done, the saline is just going to basically debubble and nothing's going to be left. So we need a shell around the gas that we're creating so that it stays in the blood so we can use it for what we need it for. Secondly, we really need the shell to be flexible. So not only does it need to hold the gas long enough, we need it to be flexible because it's going to be interacting with the sound beam, kind of expanding and shrinking. If it was too rigid, what would end up happening is that the bubble would just expand and burst. And that does not produce the harmonics that we need from the contrast agent. So again, that shell needs to be flexible and it needs to keep the gas in the bubble long enough so we can get use out of it. Speaking of the gas that's in the bubble also really matters for the stability and the longevity of the contrast agent. If we use really small gas molecules, those might just leak out of the shell, and then again, we're just kind of left with nothing to create our harmonic images with. Or if we use too large molecules, those molecules may never dissolve. And we don't want those microbubbles to stay hanging out in the person's body. That doesn't satisfy our rules of it being safe or metabolically inert. So the gas that they use is important, and the shell around it is also important. You can see in the moving image here, these are microbubbles. You can see the shell around clear, central area is where that gas is found. The shell is the part that is going to resonate, and between the sound beam interacting with the gas and the shell is how we are going to create our contrast harmonics. So speaking of contrast harmonics, section 17b.2 is going to talk a little bit more about the physics behind it. When the sound beam interacts with the injected contrast agent, the small bubbles are going to interact with the wave. The bubbles are going to contract and expand as the sound wave propagates through them. So we defined that cyclic contraction and expansion of the bubbles as resonance. And that is why contrast harmonics is sometimes called resonance harmonics. So we can see in the image below that is moving that expanding and shrinking, that is resonance. That is the contraction and expansion of the bubble as it interacts with a sound wave. Now it's going to interact with the sound wave in a very particular way. Remember that our sound waves have compressions, which are moments of high pressure, and we have refractions, which are moments of low pressure. When the high pressure portion interacts with bubble, we are going to see the bubble shrink. So the compressions cause the bubble to shrink down on itself. The refractions then, where it's low pressure, allow the bubble to expand. So the increased pressure kind of pushes it down. Think about a marshmallow. You can press on it, squeeze it down. That's what the compressions are doing. When you relax the pressure on the marshmallow kind of reinflates again, it expands, and the bubble is going to do the same thing. The refraction allows the bubble to become larger. But as we learned with tissue harmonics, we need that contraction and expansion to be in a non-linear behavior. So what we end up seeing is that the bubble can only compress so much. It has a limit to how compact the gas can be within it. So we see that the compression can only happen so much. But the bubbles do not have a limit for how much they can expand, because in reality, they'll just pop if they expand too much. So during that refraction portion is when the expansion occurs, and what we see is that bubbles are going to expand more than they shrink. So that is where we get our non-linear function. We're going to get compression to a certain limit, but then we're going to get expansion, compression again, maybe a little bit more expansion, compression again, and then a different amount of expansion. So we get a non-linear, unpredictable compression and expansion pattern from the bubble, and that's where our contrast harmonics are created. Now the amount of the expansion that the bubble will go under is closely related to the peak refractional pressure. And that's going to be how little pressure is at the rarefaction portion of the wave. How little pressure is on the bubble is going to determine how much that bubble can expand in that portion of the wave. So the peak rarefaction pressure is technically how little pressure is on the bubble, determining how much the bubble will expand. It's been a while since we've had a new formula, but here's our formula that's going to help us to understand how those bubbles are reacting under the sound beam's force. So in this formula, we see that mechanical index is equal to peak rarefaction pressure divided by the square root of the frequency. As we've talked about so many times with our formulas, it's more of an avenue to talk about how these things are related. So peak rarefaction pressure is directly related to mechanical index. Mechanical index is a measure of force that is occurring via the sound beam. And so the peak rarefaction pressure we see has a big impact on the mechanical index, which is how we kind of measure how much force is being placed on those contrast agents. So let's talk a little bit more about mechanical index so we can understand the peak rarefaction piece of it and how mechanical index plays a role in contrast harmonics. So I know that I've mentioned mechanical index in the past. We mentioned it when we were talking about the different intensities, and we'll mention it again when we talk a little bit more about bioeffects. But essentially, mechanical index tells us the force of a sound beam has on the media. So for the purpose of contrast harmonics, it really helps us to understand the amount of force on the injected microbubbles. The mechanical index is monitored by the ultrasound system using the formula peak rarefaction pressure divided by the square root of the frequency, and it's typically displayed as a unitless number up in the corner of your machine. So we have TI over here, this is the thermal index, MI stands for mechanical index, and this is the value that we are interested in when we are looking at contrast harmonics. Now we're going to see a lower mechanical index when we use a high frequency transducer, or that we see small pressure variations. Remember the pressure of the trough or the pressure of the rarefaction. So those are going to result in lower mechanical indices, where higher mechanical indices are going to be associated with large pressure variations or lower frequencies. So this kind of again shows us mechanical index is inversely related to the square root of the frequency, but directly related to the rarefaction pressure. So then depending on the value of the mechanical index, we can predict the amount of harmonics that will be created. If the MI is too low, then really no harmonics are created. We're not creating enough unpredictability in the bubble's resonance. However, if the mechanical index is too high, we might end up just bursting the bubble, which doesn't create harmonics either. So what we really need is the MI to kind of be in a perfect range to create adequate harmonics for our imaging. So just as we had mentioned with tissue harmonics that the best harmonics are kind of in the middle of the picture, which tends to be where we place our pathology anyway, what we see with microbubbles is that they're about the size of a red blood cell, and they also resonate at frequencies between 2 and 4 megahertz, which just so happens to be the frequency we tend to use for cardiac applications. So again, it works out perfectly that not only are we using the frequency that we want to use, it's going to create desirable results with our contrast agents. We do still want to evaluate our mechanical indice in relationship to those frequencies that we're using. So if we see that we are using too low of a mechanical indice, kind of under that 0.1 range, we are not going to really see many harmonics being created. And that is because as the sound beam interacts with the microbubble, we're going to get a really even in and out. It's going to be a predictable linear expansion and contraction of the bubble, therefore not really creating any sound beams. And so what we end up seeing more with this is just kind of a backscatter in our image due to the weak beam. Now the mid mechanical indices, that's going to be between like 0.1 and 1. Some texts have it up to only 0.5. We are going to get harmonics out of these mid mechanical indices. We're going to start to see that nonlinear behavior where we get compression, a little bit of expansion, compression, more expansion, compression, expansion, compression, expansion in that nonlinear behavior. And because of that nonlinear behavior, we start to see harmonics being created. And this requires moderate beam strength to get here. And that is why we're getting into our mid-mechanical indices. If our mechanical index becomes too high, We are going to see really good harmonics created out of that. We're going to get tons of variation in how that bubble expands and contracts. But the problem is that they're probably allowed to expand too far, and that is when the bubble bursts. And so once the bubble bursts, we are no longer capturing that gas. We no longer have that shell intact, and we cannot create harmonics out of burst bubbles. So these are very strong beams. We get great harmonics out of it, but it's so brief because that bubble is going to burst due to the strength of the peak refraction pressure. These are some pictures taken of a contrast bubble in an ultrasound field. So this is how the bubble started. Ultrasound is applied to it. We see expansion of the bubble, expansion, then some contraction because this is where the compression is coming through. So we would then see an expansion again and a compression, and it would keep going through this until the shell of the bubble dissolved, allowing the gas out and releasing the contrast agent. So we want this shell to be flexible enough so it can contract and expand and give us that non-linear behavior. In this video, I just want to play you a little bit of a clip of it, just because you have everything linked in your workbook if you want to see the whole video. But this is a video of little microbubbles going under an ultrasonic field, and you can kind of see as they breach this part, they're very round, and then you start to see them contract and expand. And then they get these kind of funny little lumps on them. So this is kind of that resonance that's occurring. It's that unpredictable behavior. We are seeing just very interesting to be able to see the walls contract and expand as they are introduced to that ultrasound beam. To finish up this unit, then we're going to move to section 17b.3, where we'll take a little bit of a look at contrast imaging. Now, all these images that I have are from the Definity website. They are going to help kind of show how the Definity can help in the echocardiogram setting. Typically, a complete study is performed without the contrast. The sonographer or the doctor may choose to induce a contrast agent because they need more visualization of the walls or something was inadequate in the study, or maybe they want to search for some sort of septal defect. So normal exam is performed, and then at the end, the microbubbles are typically injected into the IV. Now, once those microbubbles are injected, the sonographer should have everything set up, getting ready to take pictures where that contrast agent goes, because it can go anywhere that blood can go. So as the contrast comes in, we really want the mechanical setting just right. If the mechanical index is too low, again, we're not going to see much for harmonics. The image is really just going to appear to have like a bunch of backscatter wherever that contrast agent is located. However, if we have a good harmonic response from our contrast agent, because we have a moderate frequency and beam strength, what we're going to see is the chamber is going to fill with contrast harmonic echoes. And so we get this really, really bright response from those micro bubbles. We can see the movement of the walls very clearly. We can outline them. If there was some sort of mass in here that we couldn't see before, we'd see like a filling defect. So the contrast is really helping to highlight the walls and the motion of the heart. Remember, your mechanical indice can be too high. At that point, we might be rupturing more bubbles than creating harmonics. So this is an example of too high of mechanical index. Because we are rupturing bubbles, what we're really getting is more of a swirling pattern, and we're really not highlighting the movement of the walls as clearly as we were with this one. So that swirling is not desired. This might also be kind of late phase as those bubbles are starting to dissipate anyway, because eventually they should break open and dissolve. So eventually it's going to happen regardless, but this might be because of too high mechanical indice to start with. In the cardiac setting, really contrast is mostly used to eliminate non-diagnostic exams due to low or non-visualization of the heart. I had mentioned earlier that for other organs in the US, it's not really very popular quite yet, but it has been used quite widely in Europe and in Asia. So for other organs like the kidneys or the liver, we can again inject the contrast agent in through an IV. It's going to travel through the heart, go through the cardiac cycle, and then eventually that blood is going to perfuse into the organs, into the kidneys, into the livers. How the contrast agent then is perfused into the organ and then into any suspicious lesions is going to tell us a lot about that lesion. So for example here, we have a CT on the side here. This is a kidney. And right at the back of the kidney here on the lateral side, we see this kind of indeterminate lesion. And so this person underwent an ultrasound with contrast, and that is what we're seeing over here. Everywhere that is highlighted in orange has been perfused by the contrast agent, and what we see is that little lesion ended up not filling with contrast, and that is because it is a cyst. So by injecting the contrast fluid in, and the pattern that it made was a filling defect, we can confidently say that that is a cyst versus some sort of malignant tumor. And that is the end of contrast harmonics. So you can kind of see how tissue harmonics and contrast harmonics are based under the same nonlinear physics principles, but they really do have different uses and needs within the ultrasound setting. Tissue harmonics can be used by all sonographers, where in the United States, contrast harmonics is more regulated to the cardiac side of things. However, it is picking up a little bit more traction in the general field as well, which is why contrast harmonics does fall under the ARDMS as new technology, but it is still important for all sonographers to be aware of the physics behind both types of harmonics. You have just a couple activities in your workbook to go along with this lecture, and you again also have your nerd check questions to go through as well.